Hello, my name is Divya Bharadwaj, and I'm going to be talking about mask mandates in regard to airport travel. Starting with some background, the significance of mask mandates can be boiled down to three main topics, as they are related to airports and traveling. By wearing masks, passengers can protect themselves as well as those around them, maintaining good health for domestic and international populations. With mask mandate implementation, it is important that public transportation institutions support wearing masks for both passengers and employees. Masks are especially important because airports easily spread COVID-19 since they are poorly ventilated spaces with lots of traffic. Currently, the Centers for Disease Control, or CDC, recommends that masks be worn in public transportation such as airplanes, trains, and buses for people aged 2 or older. Nationwide mandates have fluctuated as research and developments have occurred. In February of 2020, mandates were not encouraged throughout the United States, but by September 2020, mandates started to occur, with some states being stricter than others. As of now, masks are recommended but not required. Similarly, airport mandates have also changed. In February 2021, passengers and employees were required to wear masks in airports and on planes, but by April 2022, airports no longer require masks, but the CDC recommends passengers to continue to wear them. If passengers refuse to wear masks, they may be denied boarding, removed from the aircraft, or penalized under federal law. This video makes the argument that masks should continue to be required in airports as they contribute to overall safety of a large population, and there are quite a few policy influences that affect that. This section will go deeper into what entities affect mask policies, along with political, economic, and cultural influences involved, as well as who will be affected by mandates. As for stakeholders, it is important to understand who will be affected by mask policies, as well as who plays a role in deciding when they should be put into place. The CDC is involved in creating and implementing regulations, as well as keeping up with vaccine research and effects. Mask companies favor mandates because their sales will increase. Airports favor mandates because they have the intent to keep the largest number of people safe, especially during peak infection periods. The general public is affected because they must keep up with regulations put into place, as well as purchase masks. And other countries are a stakeholder because Americans will continue to travel internationally and could possibly spread COVID-19 and other diseases. So going more in depth, as for political influences, some people are more inclined to make decisions based on the political party they align with. An example of this can be seen through President Donald Trump's term, because he did not enact a nationwide mask mandate and did not wear a mask, therefore creating similar behavior on a smaller scale. Economic influences include mask mandates boosting the economy because it allowed for people to continue working and contributing to society. Consumer spending ended up increasing by 5% on average in communities that required masks to be worn, since people had to buy masks, but also because they were able to return to somewhat daily life, including shopping, socializing, and more. Cultural influences are important to recognize because some people wore masks before the pandemic to prevent infectious diseases such as the flu and common colds, and as of now, for the most part, people are still willing to wear masks when required. Some even continue to wear masks after the threat of COVID-19 decreased in order to protect themselves from other infectious diseases. As mandates are seen to help impact the effect of COVID-19 transmissions, it is important to note how they can be improved. The first step of this process is to look at flu season in the U.S. The fall and winter seasons are known for the flu, spanning from December to February. During this time, steps are taken, such as getting the flu shot and wearing masks, in order to limit the spread of the flu and other infectious diseases. These steps can also be taken towards preventing COVID-19. As of now, mandates are not imposed regularly, but through research, peak infection times can be established, and mask mandates can be a regular thing at a certain time. This will help the public prepare for mandates and understand why they are needed during these certain times. This is relevant because airports are large hubs of people, so it's important to keep the most passengers safe during their travels. Seasonal mask mandates can play a serious role in decreasing the effects of COVID-19 felt around the world. Now, for a quick recap, in conclusion, Mask mandates have continued to fluctuate throughout infection peaks to ensure safety. As of now, they are recommended in most locations. Regarding stakeholders, the CDC should continue to utilize their position to further research and create effective mandates. In order to provide the public with the most beneficial forms of policy, political, economic, and cultural influences should be taken into serious consideration. And lastly, by streamlining mandates to a particular season, stakeholders can prepare themselves for mandates in order to keep the U.S. population, as well as the global population, safe from COVID-19 and other infectious diseases. Thank you.